So you're asking yourself, should I get buccal fat pad removal to enhance my jawline? Well, think again. As far as I'm concerned, the buccal fat pad removal has very little to do with jawline definition. I know, you might have read a paper written by Dr. Rourke himself, who I respect immensely, that talks about buccal fat removal and the possibility of its role in jawline contouring. He's not the only person who's talked about it. A lot of people think that slimming the midface can have an important impact on jawline contouring. I respectfully disagree. As far as I'm concerned, there's a lot of things that go into jawline definition. And the easiest thing to fix is skin and soft tissue. So things like facelift or facial liposculpture or FaceTite, which is radio frequency assisted lipolysis. We have a lot of videos on these topics, are really great at helping you define jawline contour. If you don't have the native anatomy to have good jawline contour, we can augment it with custom or off-the-shelf silicone, PEEK, or MedPort implants. But really, I want to spend the next 5 minutes or so talking about the role or lack thereof of buccal fat in jawline contouring and definition. As many of you know, I had my own buccal fat pads removed about a year ago, not quite a year ago, maybe 10 months ago. And although I do see some important improvement, a lot of the change that I've seen, and this is the same for my patients, is sort of in the submalar region, above my jawline and above the upper border of my mandible. It's higher than I would have expected in myself, and it's higher in many of my patients, and it certainly had very little impact on jawline definition. I wouldn't say it hurt it in any way, but it certainly didn't help define it. The reason being is, as I describe it, the buccal fat pad contributes to volume in the lower third of your face, in the anterior or middle third of your lower third of your face. Does that make sense? Did I say that backwards? Think of your face as sort of a tic-tac-toe board. If you were to draw your face in thirds and then have thirds forward, that lower middle third above your jawline is kind of where the buccal fat pad sits, but it doesn't really weigh on the jowl enough so that removing of it improves jawline contouring. In some patients, I do see some evidence of this, but not enough to tout buccal fat pad removal as a jawline contouring operation. If you want better jawline contouring, you can consider fillers, you can consider liposculpture, and you can consider alloplastic implants or even a facelift. But buccal fat pad removal alone, although it serves a great purpose in many patients, will not likely improve your jawline contour. If you're thinking about getting buccal fat pad removal for jawline contouring, think again. Have a great day. If you have any questions, retorts, opinions, or comments to this video, don't hesitate to leave your impressions below. Thank you so much, and be sure to subscribe.